name is Zainab Mai-Bornu from the University of Leicester. So I'm affiliated both to the Center for Trust, Peace and Social Relations at Coventry University, and of course, the Center for Development Studies, University of Bath. So I'm, like we say in Africa, I have, it's an extended family. So thank you very much for joining us. Today, it's all about doing development research differently during and beyond COVID-19. I have the pleasure of introducing very interesting speakers from both the CTPSR and Center for Development Studies at Bath. So we have Dr. Mohammed Alruzzi from Department of Social and Policy Sciences, University of Bath. I have Dr. Toni Cela, Coordinator for Inter-University Institute for Research and Development. She's also an affiliated scholar at the University of Miami's Department of Anthropology and MIDEC researcher. I have Professor Crawley from CTPSR, Coventry, and she is the director of MIDEC, that's Migration for Development and Equality. I have Dr. Neil Howard from Department of Social and Policy Sciences at University of Bath, and also Dr. Andrea Purdekova from Department of Politics, Languages and International Studies, also part of CDS at the University of Bath. We also have Dr. Ezechiel Sentama from CTPSR Coventry. So without taking a lot of time, each of the speakers will be given 8 minutes to talk about, their research experience. And we expect that they will answer 3 questions. The first being, what is your research? Second question is, how has it changed and as a result of COVID and its effects? The third question is, how do you evaluate these changes? So I'll now, without taking much time, I'll now hand over to Dr. Mohammed. So please, each one could quickly introduce yourself, and then we get down to the business of the day. Thank you.
Thanks, Zainab, and thanks everyone for joining us today, and thanks for the organizers. I think this seminar is very timely, and it will allow us to reflect on what has been going on during the pandemic and beyond. And I think we could learn a lot of lessons from this experience, trying and experimenting things for the first time and taking them beyond the pandemic itself. My name is Mohammed Alruzzi, and I am a postdoctorate research associate at the University of Bath. And for the last 2 years, I have been involved in a research project funded by UKRI and FCDO. And the title of this project is Challenging Neglect from a Systemic Perspective, Child Protection in Jordan and in Palestine. And this project, the main focus of this project is to investigate the protection needs and concerns experienced by refugee communities and population of conflict-affected areas, and to look at how the population and the communities in these areas respond to these needs and how they address the protection concerns in these areas. And for this research, we employ a number of methods. Most of them are qualitative, including semi-structured interviews with caregivers and young people, including children, and also key informant interviews with practitioners and policymakers in the development sector, and participatory workshops with the wider communities we are working with. And primarily we work with 5 different communities, and these are the Somali, Sudanese, Iraqi, and Syrian communities in Jordan. And in Gaza, we work with the Palestinian refugees in the refugee camps in the Gaza Strip in Palestine. So we work with these 5 different communities in answering the research questions. And central to our methodology is the reliance on the peer researchers who are undertaking most of the research activities in the field. And this has been the design of the project before the start of the pandemic, but it was a good fit actually during the pandemic because of the restriction on the movement and because of the restricted mobility, the social distancing that need to give more authority and more space for the local actors to be more autonomous and to take research in their hands. And this takes me to the second point, which has to do with the pandemic and how it have affected our research. In fact, it affected our research in both positive and negative way. The travel restrictions impacted our communication, our in-person meetings, and this has generated a completely different dynamics in terms of building trust with the local partners and made it more difficult to build the capacity and to learn from each other. Most of the meetings were done in Zoom, so it wasn't very spontaneous conversations, and it lacked that human kind of interaction that we can have by sharing the same space. But on the other hand, the fact that we weren't the research team based in Europe weren't able to join the research team in Jordan and in Palestine, gave more space and autonomy and independence for the peer researchers who were located in these institutions, the partnering institutions, both in Jordan and in Palestine, and allow for more decision processes to take place away from where the grant is held at the University of Bath, for example. So this was, I think, is a very important opportunity for ways of doing research in a different way. Of course, we face many dilemmas when conducting this research. For example, one of these dilemmas has to do with organizing or responding to the restrictions related to COVID. The fact that, for example, that we are expected by the university and the funder to do tests and to take enough precautions while undertaking the research activities. Some of these measures weren't accepted totally or fully by the peer researchers. So we were in this kind of dilemma, to what extent we can negotiate that requirements that are required by our institutions, but also without allowing for a paternalistic and hierarchical way of communication to happen from the global north to the global south. So these were some of the issues that we have faced, but overall the experience was positive. And also this was featured in the way the peer researchers like reflected on the overall experience, but also in the sense of the ownership, which was developed throughout this process. I think it was important to see that the peer researchers were taking this research in their hands, and they were taking the initiative, meeting for example, the UNHCR and explaining to them the research findings and taking the research into a different direction than it was originally envisioned. I think we were happy to see that kind of collaboration happening in a more horizontal way. Although, of course, still there are many ways that we can improve this kind of collaboration. But overall, the pandemic was negative in restricting our spaces of collaboration, but it also allowed other modes of collaboration to happen between institutions that are based in Europe and institutions that are based in the global south. I think this is overall like a general idea about our research, but I'll be happy also to reflect on some specific aspects in the Q&A question section later on. Thank you.
Thank you, Mohammed. I'll now invite Dr. Toni Cela.
Good afternoon, everyone, or good morning, depending on where you are. My name is Dr. Toni Cela, as was stated. I represent the Inter-University Institute for Research and Development in Haiti. I've been the coordinator there for about a decade now. I also represent the Migration, Development, and Equality Hub, which our director is here, Professor Heaven Crawley. So I will let her talk about the larger structure because it's quite massive. However, it entails examining these issues, the issue of South-South migration in particular, with respect to equality and development within 6 corridors. And I am part of the Haiti-Brazil corridor. In 2010, after the earthquake in Haiti, there was a large migration toward Latin America, principally Brazil, because of the impending World Cup and Olympics. And so our research really focuses on that migration, which has now become quite transitory in nature, but still flowing in that direction. So we focus in Haiti on 3 particular axes We're looking at migrant perceptions, knowledge, and decision-making, the role of intermediaries in informing those perceptions, spreading information, misinformation, facilitating knowledge circulation, but also withholding knowledge, as well as influencing decision-making among migrants and their families. And we're also looking at gender inequalities with respect to South-South migration. With regard to gender inequality, we look at it from the perspective of how does gender inequality in Haiti follow or travel with migrants and follow them to the host transit nation, and how does gender inequality within the nation itself inform the migrant experience while they're there or for the time that they're living there. So in terms of my discussion, I want to focus on the context of COVID-19, because while there are general themes that we all are experiencing, Zoom fatigue, Microsoft Teams fatigue, there's some contextual factors that make the experiences unique to the different sites that we're discussing today. So in the case of Haiti, the state of emergency was declared on, I believe it was March 19th, 2020. However, we had been undergoing political instability since about July of 2017 as a result of IMF subsidies being pulled, and so fuel prices went up exorbitantly. And the government decided to make that announcement during the World Cup game. Brazil was in, I believe, the finals, and Haitians are big Brazil fans. And the expectation was Brazil would win and nobody would notice that the subsidies were gone when the announcement was officially made. Brazil, unfortunately, lost. I think there were maybe 2 goals in the first few minutes or something, and everyone kind of shut the television off or stopped watching the match and realized that these subsidies were pulled. And that resulted in an immediate response. People took to the streets and were furious. Prime Minister resigned within a week. So from then, there were kind of a number of cascading events that led to political, there was also the Petrocaribe scandal, in which funds from the Venezuelan government, as well as low fuel costs, but the funds from Petrocaribe were used to support social programs at it was a low interest loan. And what we found out was that millions of dollars weren't found, and the sitting president was implicated in this scandal. So basically from 2018 onwards, there were ramped up protests nationwide, consistent month to month. And by 2019, businesses, schools, everything was shut down for almost a 9-month period, and had literally opened back up January before the pandemic. So students were in school for maybe 4 or 5 weeks, businesses started to open up, and then we're hit with this COVID-19 pandemic. There was a lot of frustration with the government. The Petrocaribe scandal had not been resolved, still has not been resolved. And by then there were calls for the president to step down, which he would not. So when COVID-19 was declared a state of emergency, of course, that was Latin America and the Caribbean following suit from the United States. That's how it usually works. Once it's declared in the United States, airspaces are shut down. And so Haiti was in essence forced to shut down for about a period of 3 to 4 months until about June. We reopened in June. So initially, we actually conducted a study in August of 20 on the impact of COVID-19 on Haitian families. And so my discussion is going to focus around that study. When we went into the field, part of our training included COVID-19 PPE, protection training. So we had masks provided for all of our enumerators and ethnographers, and we gave all of our field workers masks to distribute to participants. So they were allowed to offer them masks, which the participant could decide to take or to reject. And they could also decide to wear during the interview or not wear, depending on what they felt comfortable with. So if the respondent didn't wear a mask, our interviewers were supposed to sit within 6 feet distance to protect the interviewee as well as the interviewer. So we had all of these protocols put in place. We also encountered that we would go to communities that felt that these, first they believed that we were government agents there to perhaps vaccinate them or force them to do something against their will. And because of the anti-government sentiment, sometimes we were met with indifference and sometimes hostility. The mask also made us others or foreigners or outsiders in some communities that didn't believe COVID-19, was real in Haiti, felt that, immediately saw us wearing the mask. And so they identified us as outsiders, which can be problematic when coming into a community. Although I should say that all of our research teams are hired locally, our supervisors may not be local, so we generally make sure that we have safe entree and someone who can serve as an intermediary for our teams, for their safety and protection. So one of the concerns with COVID-19 was that we were coming to indoctrinate people about COVID-19 and that it was a government creation to distract against nationwide protest. So there was that element of that. And I should also add that in Haiti, as well as the Dominican Republic, there was a sentiment that COVID-19 was a virus that was happening in Europe, the United States, in foreign countries. And the first people who were identified as infected were in fact foreigners, and which may be more reflective of the fact that they had access to testing that the local population would not necessarily have had. So there was a period of time where the belief was COVID-19 is a foreign virus. It doesn't affect Black people or people of color or us. So that created some challenges for us in the field. However, what COVID-19 also did is it introduced new approaches to conducting our research, to meeting with each other. As Mohammed just shared, we were actually able, we had about 5 or 6 sites during the COVID-19 study, and we were able to conduct our training remotely at each site. So each team was at their respective sites, and we had a team at INURED that was based in the capital, and we were able to conduct the training remotely and using the technologies available with video cameras. And so it really gave us another tool to, admit into our toolbox to function and to continue our research and not to allow our work to be disrupted. Finally, we were also able to conduct interviews using Zoom, WhatsApp, doing focus groups using these technologies. So in many ways, it helped us really expand our ability to continue our work in very challenging circumstances. So with that, I will leave it to Professor Crawley to talk a little bit more about the MIDEC Hub.
Thank you, Toni. Now I'll hand over to Professor Heaven Crawley.
Thanks, Zainab, and thanks, Toni, for making my job easier than it might otherwise have been by giving some insight into the practicalities and the logistics of doing research as part of the MIDEC Hub. So just want to say a little bit more about MIDEC, because I think what's important about MIDEC is not just what we're focusing on in terms of research, but how we're trying to do it. MIDEC has a very long name, which is the UKRI GCRF South-South Migration and Equality Hub. So it's one of 12 hubs that have been funded by GCRF to engage with the contemporary challenges. And I'll touch in a little while on some of the funding challenges, because they have also, of course, been operating for us very much in parallel with the COVID-19 challenges. So as Toni said, what we're doing within MIDEC is very much trying to look at not just South-South migration as a very much a neglected aspect of migration, which has not really been a focus of so much academic research, largely because policy and politics is much more interested and funded by institutions in the global north who are interested in South-North migration. So we wanted to sort of shift the lens to the South-South migration, which is a very important component of international migration in general. But specifically also then look at those forms and processes of migration in relation to development in general, and the SDGs in particular, and the intersections with inequalities of the kinds that Toni was describing. So we have a very complex structure, just to give you some sense of the scale. We're something near 100 researchers in 13 countries, and the vast majority of our resource is basically oriented towards the research in the Global South partner countries, which are organized into these six different corridors of sending and receiving countries, if you like. So the key for us, and it's part of the research design, is not just to produce knowledge around these issues, but to decenter the production of knowledge away from the North, where typically it has been dominated, in part because there's whole issues of capacity and bringing out what already exists in the Global South, but also because the politics of this and the kind of academic categories associated with migration research are very driven by the particular agendas of the Global North. So the design is aimed so that the vast majority of resource focused on supporting teams in the Global South to do the work. And then we have 11 cross-cutting thematic strands, which are led mostly but not exclusively by researchers in the UK. So, I mean, we could talk at length about research design, and I think it's a really integral part of how we actually end up doing the research. But I think what was really important for us was that from the get-go, we were trying to do something a little bit different and try and very consciously actually move away from and decolonize, if you like, the ways in which knowledge is produced. But immediately we came up against some challenges. And one of the challenges that I think was very apparent before COVID was Global North partners being, in some cases, although they were part of the research, of course, and the research design and part of the project, it was quite challenging to have them not directly involved in the fieldwork and the data collection, because historically that's what's tended to happen. Particularly the idea of fieldwork, which is of course a very colonial concept of dropping into a country where you perhaps have no experience of a context and no language skills and no real knowledge of the very complex political and economic situation of the kind that Tony's describing. And yet you imagine that somehow, because you have this expertise, that you can arrive for 2 weeks or a month and you will somehow be able to add value to what the researchers already in the field and much larger numbers have been doing for months or years already. So this idea of experts and how expertise is brought to bear in particular contexts was a challenge for us. And it was partly a function of how the project was designed because of the work packages and the country corridor format. But it was also because historically that's how research has been done. It's been a very extractive model along the lines of colonization more generally. So we extract knowledge, we extract data, we repackage it and we present it as our own almost, as the experts in the Global North, making sense of this and trying to bring some sort of like structural organization and theoretical understanding of what's going on. So I think, you're not going to undo hundreds of years of extractive processes associated with colonization in a few years of one research project. But I think I was quite shocked at how that worked in practice when we were starting to embark upon this process once we got the funding. Now, coming on to COVID, I mean, we had all sorts of challenges of the kind, again, that Tony has described in relation to the doing of the research, practically, and in terms of the possibilities and the issues around trust and security, and some of those that Mohammed has also alluded to. But if I'm perfectly frank about it, and I'm happy to be frank on this occasion, I think it really helped our overall objective of decentering knowledge, because it basically made it impossible for the Global North researchers to travel. And whilst all of us personally found that very difficult, I think in terms of the integrity of the research design and letting the researchers in the South just get on with it and really do whatever was most appropriate to those contexts with no kind of interference, because it was really impossible for us to know what was happening. I think it was hugely beneficial. I mean, I don't know necessarily that it solves the bigger issue that I was alluding to in terms of the kind of the way in which knowledge is produced, but I think it was a really clear example of how it could be done differently if the Global North researchers were willing to step back and allow people to get on with doing what they think is most appropriate in the ways that they think are most appropriate. And that's what we would want to happen. So now we're in a situation where, and alongside this, we had the funding cuts, which actually, has been devastating in many ways for MIDEC. But we made a decision when we had a funding cut of 70%, that 100% of our resources would remain with the Global South. And so Global North partners, if they chose to maintain their role in MIDEC, were not funded for that work for a year. And so that kind of, I guess that what that did was solidified that approach of allowing and enabling the Global South to researchers to just get on with doing that work. So those two things, in some way, as awful as they both were, the funding cuts and COVID, have have helped embed those ways of working within the project. And I hope a little bit perhaps more generally in terms of South-South migration research, by building the capacity and the expertise of the people who know what they're talking about. I still think we have a big problem about what happens next, if I'm perfectly honest, because, you know, we now have a huge amount of data produced by our Global South partners, and very clear in our structures for MIDEC that we need to codify our processes so that that doesn't then just become another extractive process. You know, give us your data and we'll now go away, having not traveled for 2 years, and write up our research reports, etc., based on your work. So that isn't going to happen in MIDEC. We have very particular processes in place to ensure that doesn't happen. But now we have to kind of reintegrate these different forms of knowledges and these different ways of seeing the world and see what happens next. And I think that's the next challenge for us within MIDEC, is to bring those parts back together and see what, if anything, it's changed about what comes out of the project. So I think there are big structural inequalities here at stake, aren't there, in terms of resources, in terms of language, in terms of, you know, the UK government can turn around and say, we're going to reduce your funding by 70%, and our Global South partners just have to tolerate the consequences of that. So we can't get away from that, those huge inequalities. But I would hope that, you know, within how we set up the structures for MIDEC and some of the things that have happened as a consequence both of COVID and the cuts, may go some way, at least to creating some learning about how we could do things different in the future, even if we don't manage to get everything perfectly right in one project over 5 years. So I'll stop there, but there's lots more I could say. So I'm happy to pick up on any points in discussion. Thank you.
Thank you, Heaven. Dr. Neil Howard, you're next.
Thank you. Hi, everybody. So, yep, I'm Neil. I am a lecturer at Bath. I guess I'm here and I've been invited to be here because I'm involved with and co-direct 2 projects that do similar things, one in India, one in Bangladesh. Both projects basically combine unconditional cash transfer / unconditional basic income and support for forms of community organization in certain informal settlements. One in, or a number in inner city Hyderabad in southern India, and one larger one in Dhaka. The research emerges out of a bunch of historical collaborations between folks who do action research, between people who work on so-called unfree labor, and particularly the pretty shitty ways in which it is governed, and between folks who advocate for basically just giving money to people because you need money under capitalism, and when you don't have it, you tend to face difficulties. Each project is pretty large. There's across the 2, maybe about 40 plus people that work together, multiple institutions, obviously Bath, IDS in the UK, and a series of partners in India, in the UK, in Bangladesh. Each project is hyper collaborative in the ways, many of the ways outlined by Heaven. So it's, although the lead institutions are in both cases in the UK, largely because of the funding streams. One project is funded by what was DFID and the other by the EU. The sort of governance structures are wholly collaborative, and all of the design work has been, over the course of COVID, like co-generated over many hours on Zoom, as I'm sure is the case for many folks here. I can say loads more about all of these things and happily share a website, but I'll just reflect quickly on some of the impacts, the changes that COVID has wrought. I won't say too much about any of them because there's a few and my time is short, but they can be sort of divided into structural, operational and personal, which feels also important to talk about. So like at the structural level in both projects, unsurprisingly, there were massive delays. We were literally, my colleagues and I in the UK, and some colleagues who were neither in the UK nor India, were literally getting on a plane to go and meet in Hyderabad when lockdown was announced and had to turn around. And of course, then there was an enormous and terribly disruptive lockdown in India as well as everywhere else, which meant that many of the activities that we were planning simply couldn't take place, often for many months. That also meant sort of quick reorienting of a lot of people's time towards basically humanitarian work. For those of us who are far away from the places that we are working on the ground, that meant fundraising, as well as a lot of work, engagement in mutual aid networks within the UK where we were. And for our comrades in India and in Bangladesh, it literally meant relief work. Again, more to be said about that. Another massive structural challenge, DFID basically, well, literally ceased to exist and just ate billions of pounds, including from our projects, which meant also going through many of the same challenges that Heaven outlined, working out how to distribute the pain, basically. We did very similar things to that project, but it did mean massively reducing time, people are working way more than they should have done everywhere within our team. It meant, in the case of the Bangladesh project that I work on, which is part of a much wider, larger consortium, it meant actually losing one of the countries of operation, which was also due to war, and therefore it was deemed unsafe. Nevertheless, like massive shifts and lots of people lost out in ways which were really, really quite challenging. And I won't go into too much detail, but just at an interpersonal as well as an organizational level, this structural shift was very, very painful for lots and lots of people involved. At the same time, I don't want to be one of those like crisis is an opportunity people, particularly in the context of crisis that was enormously difficult materially for billions. The work that we work on was massively more interesting to everybody who mattered, right? From a power perspective, people who had money to give away as well as money to take away. Basic income, cash transfers literally rocketed onto the political agenda pretty much everywhere, certainly in donor nations, which has been interesting and significant and has meant the more, I think, radical work that we are doing has reached more ears than it otherwise would have done. So those are kind of like some of the structural pieces. Operationally, I guess that the changes that we have experienced and the challenges we have experienced have been similar to many others, a lot less travel, which I think has been a fundamentally good thing for obviously the planet in terms of the diminished carbon consumption, also for well-being and for team dynamics. So how we've managed to manage that is essentially, as I said earlier, many hours on Zoom, finding innovative ways to facilitate things on Zoom, innovative technologies to do, I mean, we work in an action research paradigm, so finding ways to do sort of action research type planning online has been exhausting, but also way more successful and effective than I anticipated it being. And I guess relating to that at a personal level, it's been paradoxically way more connecting, basically because everybody's life has been pretty crap in one way or another. Lots of our team have caring responsibilities, whether that be older relatives, people who are sick, the humanitarian work they're engaged with, or kids. And of course, like care, like it has everywhere, has just erupted into the apparently separate world of work. And so in my case, for example, my kids are now very well known by dozens of people that I work with. Many of the folks I work with in multiple locations have like actually seen one of them be a bump, then be born, and now be one and a bit. And that's, of course, challenging because they make a lot of noise and are often in no way interested in not smashing the keyboard or whatever it might be. But again, enormously connecting because there's a level of like realness and humanity that I think these shared struggles have enabled us to bring in. Even if we were design the way we work to bring our personal lives much more comfortably than in other contexts I previously worked, I think strangely the separation has allowed more connectivity than otherwise would have been the case. There's loads more I could say, but I think I've already done like 7 minutes, so I'll just briefly finish. In terms of like an evaluation of how this has been, the third question, then your third question, it's kind of balanced, I think, between what has been good about this and what has been bad about this. There has been an enormous set of challenges, like things have had to be reshaped. We had to go through a process of like massive redesign, for example. As I say, in both projects, we were running a combination of an unconditional cash transfer trial with community organizing. And DFID just ate the cash, or at least put pause on us giving out the cash for a year, which meant A, fighting very hard just for our survival because of the humanitarian element of the work that our team were doing within this slum in Dhaka was particularly important, and B, meant pivoting towards emphasizing more the relational aspect of the work that we do while still struggling to get the cash back so that we can give people cash. Again, I'll stop because I see you waving at me, but I would happily go on for hours and hours and hours, so thank you.
Thank you, Neil. Dr. Andrea Purdekova, you're next.
Hi, so I'm Andrea. I'm based in Bath in politics, languages and international studies. So in short, just a quick introduction to my research. In a couple of words, I work in conflict-affected context. on questions on politics of nation building, politics of reconciliation, and politics of memory in the wake of violence. So over the past 15 sort of years, I have mostly worked on the Great Lakes region of Africa. So conducting research in Rwanda, Burundi, and much more recently in the context of Kenya. So this was on memory, or rather the lack of management of memory in the wake of Al-Shabaab violence in the country. But really my main expertise has been in Central Africa, or Great Lakes region of Africa. In the past sort of couple of years, more specifically, I have been looking at the politics of memory, the governance of memory in the wake of conflict, and how countries emerging from localized mass violence can deal with this very differently. So I've looked at sites of violence and specifically at uncommemorated spaces and practices of rectification. So the return of prior mundane use of spaces of violence, basically returning them to prior use, and the implications of this for memory, for public amnesia, and transformation of conflict. So yeah, I've done this in the case of Burundi, as well as more recently, as I said, in Kenya. So these are kind of the principal sort of themes that I explore in my research. So maybe just finally, I'm trying to now pull this kind of together in a more comparative way, trying to see how there are different paths to forgetting. So how memory and power interact in different contexts after war. So really kind of marrying the literature on transitional justice and memory with literature that usually is very separate around transitions, political transitions. So how, say, a context of victory shapes memory and oblivion in a different way than power sharing context, and so on. So that is kind of my current research. In terms of COVID-19 and the reason I'm here, so recently with two of my colleagues, we published a research note on COVID-19 and specifically ethics of research. So this was with two people I know well and collaborative work also in the Great Lakes. So one is David Mwambari, a Rwandan scholar in the diaspora who works at King's College, and Aymar Nyenyezi Bisoka, who is based in Belgium at the University of Mons. And so we both work on Great Lakes region, very similar issues of politics of memory, state building in the wake of conflict, and so on. And so we wanted to explore a bit, what does all of this mean for us going forward, right? As we continue with our research, as we are trying to put together grant proposals and so on. So what does it mean when we utilize platforms like Zoom increasingly for research? And this doesn't mean that we only use those sorts of platforms, but what does it mean when we increasingly platform our research through Teams or Zoom or in this way? So last year we published a very short sort of research note around this. It was entitled COVID-19 and Research in Conflict Affected Context. So we really try to think about conflict affected context and what does it mean to platform that sort of research online. So for us, it was more dilemma about continuing. So it was not about starting in a completely new communities or with completely new interlocutors. So it was more about, how do we continue and to what extent can we really do this through platforms such as Zoom. And so what we discussed there, I mean, I invite you to read it. It's kind of a very short piece. It's published in Qualitative Research, so it was last year. And maybe some of these, some of these topics might be less relevant now. They were more pressing, I think, in the past. But there were three sorts of things that we highlighted and that I would like to kind of mention on our behalf. But it was very much a collaborative sort of reflection. So the question was, what are some of the key ethical challenges associated with increased platforming of sensitive research online? And so one of the things that we highlighted was surveillance and perceptions of surveillance. So we have to remember that these are encounters about sensitive topics, and perceptions and concerns, obviously, around this need to be addressed. And we felt that moving this kind of research online will likely mean researchers have to become quickly attuned to what Lian Fuji called in her offline research in post-genocide Rwanda, metadata. So really a wide variety of nonverbal cues, such as evasion, silencing, facial expressions, or tone of voice, which communicate meaning without necessarily verbalizing. And so we are attuned to this in offline context. We know through our methods training that this is what we need to do in countries and dealing with sensitive topics. But how do we then translate that kind of thick reading without those contexts, without being in person, even though we might have previous research experience? So how do we actually do that kind of more nuanced interpretation online, and to what extent that can be actually done? And I think we don't have one kind of universal answer to this. We are just saying we need to really grapple explicitly with these sorts of ethical questions and answer them as we go, and with regards to every particular project. So the second issue that we highlighted, we called digitalization of suffering. So we see online research, again, wherever it comes from, whether as a continuation, an add-on, as part of kind of a more hybrid approach, or as, starting a new project, as really challenging in terms of the capture of complexity in settings affected by conflict and trauma. We feel that there is risk of reducing that complexity of social phenomena, omission of important aspects of lived experience of violence, peace building. And of course, we can't compare immersion, contexting, trust building with these sorts of encounters. So we feel that this kind of more distance research, we're not rejecting it, but we say that, it does bear very real limitations, epistemological, but which are inevitably then ethical as well. And then finally, we try to reflect a bit around what does this moment of crisis mean with regards to decolonization or possibly recolonization of real knowledge production. Again, we invite people to discuss this and reflect around this explicitly. We're not offering any sort of answers. But if we really think about decentering Eurocentric approaches, if we talk about more epistemic freedom for context that we study, to what extent has the crisis allowed this? What do we think that has been achieved? Who sets the agendas? Who asks the questions? Whose interests in research are privileged, and so on. So these are some of the questions that we are asking, and that we are urging that people should explicitly sort of reflect on as they embrace these kind of online platforming, which again, we are not rejecting wholesale. We mentioned issues around climate concerns. Again, these things have very different sorts of answers for people who already have established trust and relationship, versus those who start completely new projects. So there are, of course, positives and negatives, but our point in the article was that we need to focus on some of these kind of ethical challenges as they arise. And of course, there is, the issue of exceptionality of COVID, and to what extent, again, this is not more of a northern perspective on, this being an exceptional crisis transforming, to what extent is it really that, and to what extent is it entrenching the sorts of power inequalities in research that we've seen before. Thank you.
Thank you, Andrea. Last but not the least, Dr. Ezechiel Sentama.
Thank you, Zainab. Greetings to everyone. I'm very happy to be here today. Briefly share with you how my research project has been affected by a COVID pandemic. I would say I'm Ezechiel Sentama. I'm currently a research fellow at the Center for Trust, Peace, and Social Relations at Coventry University. But previously, I worked in Rwanda for several years, and in Sweden for quite a number of years too. I moved to the UK, Coventry University, as a Marie Curie Research Fellow just in September 2019, when COVID was actually knocking at the doors of the world. So during the pandemic, I had started working on my Marie Curie project. I would say that my project, which has already been completed, was entirely affected or carried out during COVID. So the project was focusing on transitional justice and reconciliation in peace building. So I share the research interest with Andrea, because my research interests are on peace building, transitional justice, reconciliation, and peace education. I was also involved in a number of projects, including that one on peace education that had Rwanda, Macedonia, Israel, Palestine as case studies. So this project on transitional justice and reconciliation in peace building considered the case of Rwanda and Algeria. So it was focusing on how reconciliation processes, transitional justice processes function, but especially how their combination affect peace building. What happens if those processes are combined? And this project the plan was that the project was supposed to rely on field work in Rwanda and Algeria, and it was supposed to involve, of course, face-to-face interaction and data collection through interviews, and especially visual images or visual methods. You can already see how this project was affected. I also had a plan to engage face-to-face in research exchange or research sharing and community engagement in Rwanda through seminars and workshops, and also in Algeria through seminars and workshops, but also in the UK within the perspective of my secondment to Coventry Cathedral. COVID affected all this, and that's what I'm going to share with you briefly. I would say that my project was 90% or 95% affected. The only part of it that was not affected was that I was also supposed to carry out, use desk study in collecting data. So almost more or less everything changed completely. I had to start my fieldwork in Rwanda, and I had that sense because already in December and January, COVID was already there. And I had to rush and travel. I traveled to Rwanda in February, end of February actually, and I had in mind COVID issue and the imminence, that lockdown was imminent. I intensively carried out interviews and the focus group discussions. Of course, I was not able to engage with the participatory visual methods, but within 2 weeks with intensive field work, Rwanda imposed its nationwide lockdown on March 15. So fieldwork came to halt, and I was obliged to shorten my stay in Rwanda and return to the UK. And in the end, it was completely impossible to conduct fieldwork in Algeria. The only possibility or alternative was to rely on online interviews through Zoom, and of course, secondary data through a desk review. Generally put, COVID had negative impact on my project, even though I tried my best to ensure that at least I access the needed valid data. My research involved fieldwork and was affected. I would say that I accessed few participants in a comparison with those that I had planned. And the most part of this, which was negative as far as my project was concerned, is that some participants, a number of participants actually, were excluded. These are marginalized people in Rwanda and Algeria, poor group victims, including survivors and the perpetrators. So it was impossible to access them online. And the main reason was that they can't, most of them, if not all of them, they can't use digital literacy or access digital technologies. Therefore, I relied on those who were available. For the case of Algeria, I was only able to now broaden the list or the focus on participants and include also those who are living in diaspora. One of the biggest challenge was because of how the project designed, it was impossible to postpone or extend the duration of the project. And if I share with you maybe my experience in conducting interviews online using Zoom or other similar facilities, it was an ethical issue, which refers to security and confidentiality of as far as research is concerned. Because when you interact with somebody using video or Zoom, he or she does not know whether I'm seated alone in the room. Maybe there are people around who are maybe recording or maybe listening to what we are saying. But also me too, when I'm interviewing somebody, I just see the person, the image, or the face of the person on screen, but I don't know whether the person is alone or around. So this was difficult for me to know how to, to interact with the person. So another negative maybe thing I could mention is that it was impossible in the end to share my research experience and results through research exchange, face-to-face or in person, apart from only doing so during presentation in the seminars and in the different conferences. Maybe the only positive thing I realized was that I was able to access other research participants that I did not plan, that I wouldn't have otherwise accessed. I was able to access people, participants from Germany, from the UK, from France, from Algeria, of course, all over in Africa. And this did not engage any transportation or any cost as far as transportation is concerned. So my project was affected, but I also learned lessons that whenever, in those circumstances, as a researcher, you have to always be awake and be creative and develop new ways of engaging with our research projects. So I will stop from here. Thank you.
Thank you very much, Ezechiel. Wow.